Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. So, I want to know ICU or ER, which one do you think has the better teamwork?
Uh, it depends on the situation. It depends on the coworkers. It depends where you are. I've
Yeah.
been in ICUs where I've had no teamwork. I've been in ICUs where I've had the best teamwork.
Yeah.
I've been in ERs where they do nothing to help, and I've been in ERs or same ERs. Especially, this depends who you're with, or how busy the situation may be. You can either have all the help in the world or no help. So it all
Yeah.
depends. Because I know in ICU, there's times where it can be chaos and uncontrolled, but for the most part, it's pretty controlled.
Yeah.
So if the person next to you at the nurse's station has a minute to help you with an admit coming in, they're going to get up and, well, I would hope they get up and help.
Yeah.
But you don't get that all the time, though. It's in both units. But in
Mm-hmm.
ER, we had an intercom where you just hear, sometimes you'll hear sirens. This is Medic 13 going to this hospital, code 3 traffic. Okay, code 3
Mm.
traffic means it could be CPR in progress, it's something serious.
Oh,
So
okay.
that's when we get the intercom or we get the radio report, and then we assign them a room, and then you'll see the paramedics come in doing what they're doing, firefighters, cops, whatever. And then when they're going into the room, sometimes, for the most part, it's you, the primary nurse, and like four other people going in there, and the doc is already meeting you in there. So people are
Okay.
going in there, they're already lining them, they're already labbing them, X-rays already there, or even if it's something simple, someone came in for shortness of breath, but they're walkie-talkie. They'll help because we have our protocols that we got to do,
Yeah.
like EKG, X-ray, all sorts of stuff. Um, while you're doing your initial assessment, you'll have another nurse there lining and labbing for you.
Mm.
Um, but there's also been plenty of times where I get someone who's real sick and I get zero help. I'm trying to
Yeah.
lab a line and doing my initial assessment, connecting them to the monitor, getting initial vital signs, doing all these things, and then walking out of the room just to look at your computer and you have 60 orders coming in,
Yes. I
and
hate that.
that's what overwhelms. And sometimes
Yeah.
you can't blame anybody because your coworkers have in a ER four other patients they got to take care of,
Right.
and sometimes you're just SOL. You don't have any help.
Yeah.
Um, and in ICU, if it's a good night or if it's a good day, you get all the help you need. But there's also times where you just don't get anything. So I don't want to sit there and say the ICU gives more help or ER gives more help because that'd be the wrong answer. It truly depends um, um, where you are, who you're working with,
Yeah.
and even you as a nurse. If you're someone who people like and people want to be around, then you're gonna get all the help in the world. But if you're someone
Yeah.
who is doesn't really treat anybody with respect or anything like that, which I've had those coworkers before, then you're kind of
Mm.
less incentivized to help them. So it
Yeah.
all depends on the situation, I think.
Do you feel like being a traveler has affected the teamwork ability too, or do you feel like in both, like, it still ebbs and flows depending on the day?
It depends. I've worked with travel nurses with FEMA who are making a stupid amount of money a week. And they were not getting any help from the full-time staff because the full-time staff would resent them or whatever. They'd sit,
Mm.
I would hear them, hey,
Yeah.
you're making all this money, you're doing this, you're on your own, like you're good. And
Mm.
you're like, what the heck? So you know?
Yeah.
Um, but like I said, it all goes back to it depends. It depends on
Yeah.
the other nurses. Are they willing to help or are they not?